Hello everyone, today I will be talking about colic and gas pain in babies. Now, colic is very common in babies, though by the strict term of the definition of colic, not all babies will fit in it. So, colic is defined as a baby crying excessively for more than 3 hours in a day, for at least 3 days in a week, for at least 3 weeks. So by the strict definition, your baby may not fit into it, but it's very common for small babies to cry without any reason. You will feed them, you will change their diaper, but still they will go on crying. This can be very distressing for the parents, and especially this colicky and gas pain is more common in the evenings. That is the time when most parents are also tired and exhausted, and it goes on till the night. So they are more unable to handle the baby in these situations. But don't worry, it is very common. It will pass on its own. Usually it starts at 2 weeks of age and it continues up to 3 to 4 months of age, after which it stops on its own or decreases significantly. A few things which are a sign of colicky pain are that if your child has a very shrill, high-pitched cry, the child's face is very red, the fists are tightly clenched, the legs are drawn up, there is arching of the back. These are the common signs of colic. But otherwise, any child who's going on crying on and off is very, very fussy. Usually, it means gas pain for the baby. A few things which can be tried at home, few home remedies. Firstly, burp the baby more frequently. Formula fed babies tend to have this problem a little more than breastfed babies. So, if possible, try to give as much as breastfeeding as possible. In case your breast milk supply is less, please consult your gynecologist or pediatrician to prescribe some medicine to improve the breast milk. If your child is on formula feeding, sometimes changing the formula may help. It's not that one brand is superior or something like that, but just sometimes some babies do better with one brand as compared to the other. If your baby is taking bottle feeding, you can try anti-colic bottles. They are available in various brands, and all anti-colic nipples also. Make sure that the nipple you use for the baby is as per the age. Don't use nipples with bigger holes thinking that the milk will go more easily. No, please don't do that. Take them with the appropriate size hole. And if the baby is bottle feeding, make sure that the baby does not suck on an empty bottle. That leads to more gas and air ingestion and more colicky pain and more gassy pain for the baby in that case. Also, you can try giving the baby a warm water bath in the evening. For some babies, giving them a slight warm oil massage, especially over the tummy, helps. In India, heeing is commonly used over the belly button and around the stomach. It is put in rotational motion. Now, I really don't know if it works, but no harm in trying these things. But just make sure that the heeing is not very hot. It should be just very slightly warm when you are using it. You can take the baby for a stroll in a stroller. You can keep the baby on sort of a bouncy chair, which you get for small babies. You can take them for a car ride. If the mother is exhausted, please, there is no harm in giving the baby to somebody else. Just take rest for half an hour, 1 hour. Let somebody else take the baby for a stroll, or handle the baby, because it's nothing much you can do sometimes to help these babies. You just need to calm them down. For some babies, light music helps. For some babies, if you dim the lights, quieten the room, that helps. For some babies, if there is slight white noise in the background, like some blower running or some washing machine running, that helps them. So just try what suits your baby, and then you can fit it into your routine to help your baby during these pains. Sometimes your pediatrician may prescribe a probiotic or some medicine to be used as and when required. These can be given as per the instruction of your pediatricians, but most of the times try to do it with home remedies and simple measures as much as possible. There are a lot of concerns over the mother's diet, especially if the baby is breastfed, and in many houses, I find that the mother is stopped of almost all things. Very few things are allowed. Please don't do that. That will further decrease the mother's breast milk supply. And as I said, breast milk is always better to digest than formula milk. So don't do that. Only if you feel that whenever you're taking a particular food item and then the baby is getting more gassy or colicky, in that case, that particular food item, you can stop and see. If you stop and you still see there is no improvement in the baby, then please restart it, because we don't want the mother's diet and nutrition to be compromised. Otherwise, there is no known cause for colic. What really causes colic, nobody knows. So you can try these things. When is it a thing to really worry in colic is if the child is having repeated forceful vomitings, if the vomit is green in color, if the child is having a temperature, if the child is not gaining weight adequately, then it could be something else. If the child's stomach is getting very distended, it is very, very hard to touch. The child is crying on the slightest touch of the tummy. In that case, I would recommend to consult your pediatrician immediately. And don't worry, like most things, this will also pass. And take as much rest as possible whenever the baby is sleeping, so that you are not frustrated and irritated when these colic episodes happen. Hope that helps.